Welcome everybody to Cosmetic Surgery Forum, and it's about when do we open our practices, how do we open our practices, and what is the best way of opening our practices. So for those of you who are joining in, we'll wait a few minutes for everybody to sign on. Today's session is somewhat special because it seems like there has been a sea change in the last week or so, where almost every community has gone from either a complete lockdown to a partial lockdown, or a shutdown to a soft reopening, or frankly, a complete reopening. So we're seeing a lot of changes, and a lot of doctors, dermatologists, have questions. And so I felt it was best to convene our brain trust here and have people who are dealing with this from different parts of the country. And we're very fortunate to have East, West, South, and North represented here. So we have a wide variety of people from across the country, including Dr. George Hruza, who's going to be speaking first, past president of the AAD, Dr. Heidi Waldorf from New York, Candace Spann from Las Vegas, Nevada, and Dr. Suneel Chilukuri from Houston, Texas. So it's a great panel, and we are very fortunate to have all of you here. And again, welcome everybody. We've had a tremendous amount of interest in this webinar, because I think a lot of people are struggling over the time and the timing of opening up and how to affect this. So we'll go to Dr. George Hruza, who will talk to us about some of the AAD guidelines and some wonderful information that was generated by the American Academy. Thank you for joining us, George.
Okay, so now I'm going to figure out, because I had 4 slides, so I have to figure out how to make this work. So can I share a screen or no? How does
yes, go to the bottom. On the bottom, there'll be a little green button, share screen.
Oh, share screen. Okay, got it. Okay, well, very good. Thank you. Okay, so I'm going to start working on this. Share, okay. Share this thing. Good, and then start the PowerPoint, hopefully. Let's see.
Yep, there you are.
Okay, just want to see if my PowerPoint is coming. Oh, here we go. Okay, got it. Okay, great. All right, so the AAD about 10 days ago developed a guide, sort of a recommendation step by step, what you can do, to reopen your practice. So we sent that out about 10 days ago. Interestingly, the AMA just came out with theirs today. Plastic surgeons came out with theirs yesterday, I think I saw it. So we kind of first out of the gate on this, eager to get back to work. No. Okay, so the thing I just want to bring up is that for most of us, you really never had to shut down your practice. A lot of us shut down practices for various reasons, but it's never been that you actually had to shut down the practice, because healthcare is an essential service. Homeland Security defines it as an essential service. CDC and CMS, they were the ones that recommended that elective procedures and non-elective service, non-essential, elective procedures and non-essential services be deferred, mainly to preserve resources for COVID-19 patients. It was never to protect patients or staff from being infected with COVID-19. It has to do with preserving resources. And states were all over, from no restrictions to very onerous restrictions. So like there was some crazy stuff in Texas and various places that they were causing all kinds of hassles. So it all depends on your states. But now, as Joel mentioned, we are reopening for elective. A lot of states are reopening for elective non-essential services. For in Missouri, for example, we never had a restriction on services we provided, even though hospitals could not do elective services, elective procedures. And then today we opened up, so now barbershops can open up, bowling alleys can open up, and basically every business can open up as long as they have proper distancing rules. In our document, we put in, but the federal government said that they recommend that you start doing it when you have 4 days of downward case trajectory. But many states are kind of jumping the gun a little bit on that. I think Georgia was the one that was the first one that seemed to kind of doing it. So all of them are gradually reopening. Key thing is when you reopen, there are some pretty significant social distancing rules in place, and then each industry has their own requirements. It depends on the state. Most of them in Missouri, they basically leave it up to you to decide a lot of the details. The thing to think about is what are the optics of cosmetic services during a pandemic. That's what I've been struggling with. I think that's a bigger decision than the decision about when the state lets you to open. Most of them, you can do it right now, but it's got to do with what are people going to think. So we are all going to be reopening, but I'm very concerned about doing it too much. Like I just got an email showing, I think it was some plastic surgeons that were advertising saying, we're going to be doing the next 3 days. We're doing all Botox all the time, all day, with some specials and so forth, kind of making it a big, like with the grand reopening. I would recommend a soft reopening. Let patients know, yes, you are now available. You're seeing patients with the proper precautions. But I would not do saying like, if you come in the next 3 days, you get 20% off or something like that. I really would be cautious about that. There's already been some negative press out there, and we really don't need more of that. And social media can be quite nasty. The thing that we need to overcome is the patient fears for coming to the office. So even though CDC would look at physician offices when you take the reasonable precautions with like members, that we are really a low risk setting for infection. But we have to make patients aware of that and they're comfortable. So it's really important to communicate a lot with patients. You have to, some states require it, but even if they don't, for your own protection, you should have a COVID-19 preparedness plan. Make sure that you have all that in there. And then you've got all the usual stuff. So you got to clean and disinfect between patients. So when opening between patients, clean thoroughly. Hand sanitizers, wipes everywhere. Man, must have been doing this late at night. I see another spelling error. We keep all the doors open to eliminate any door handle contact. So the pathway from entering the office till you exit, as everything is open. We do not close any doors. And then we've developed this. I just approved this today. You'll be getting that in your email tomorrow from AAD. Kind of announcement about the precautions we're taking, and also a little bit of a disclaimer. It says we note that while we do our best to minimize by entering this office, you're acknowledging that all exposure risks cannot be eliminated. So it's relatively benign, but it still kind of tells the patient they're going to be cautious. Some people actually do consent forms and so forth, and that's certainly up to you. I think about that. You get a consent form when you go into the supermarket. I don't know why you need to do that for the office. Social distancing, reducing waiting room chairs, 6 foot distancing, no handshake, elbow bumps, fist bumps, no magazines and other reading materials, plastic shields at reception desk, which we just installed today, and patients wait in the car outside of the call to be seen, patients seen alone whenever possible. And the other thing is we do very thorough screening when they make their appointment, when they get reminder of their appointment, and when they show up. Check temperatures, even though I know it's not so accurate. However, it gives patients reassurance that you're really paying attention. And of course, if any of these are positive, then we just reschedule the patient and send them to their primary care doctor to be evaluated. We don't get into the testing. We prefer to send them to their doctor. And then if a staff member has positive to any of this, we actually have staff every day now sign in. They take their temperature, check that they don't have any of the symptoms. And if a staff member does develop it, then you've got to have a protocol about what to do, which in our case, you send them home, and then if they have symptoms, they get tested, and then can't come back until they test negative. But there are the other guidelines if you do the non-testing procedure, so there are CDC and health department guidelines you want to follow. We have all staff wear masks and protective eyewear all day so that they don't touch their face. If you have access to a N95 mask, that's reasonable, but the data on that is questionable. To me, the main setting to use an N95 mask is if you're going to work around the mouth, because you have greater risk of aerosol. You can use the same mask for days. In our office, we use it for a week, and they switch it out for another one for a week it rests, and then you can go back to the first one. And then we make sure that all patients bring and wear their masks or face coverings. And if they don't have it, initially we didn't have enough masks, so we would reschedule them. Now we do have enough masks, so then we will give them a mask. We of course do telederm stuff while the waivers are in place. And I have not been very successful in my practice. My patients are older; they don't do well with it. You can do virtual post-procedure follow-ups, and I use absorbable buried sutures for all patients, so we don't see too many follow-ups right now. I mentioned the N95 masks. Let's see. You use it especially if you're going to be using other things like dermabrasions, ablative lasers, energy-based devices. Then as far as informing patients, so what we're doing is we're going to be informing them, letting them know either by email or a letter as far as what we're going to be doing, and then the steps we're taking to take them safe. So I think that's really, really important, that they've got to know that you're really taking all the precautions that you can do. We get a little bit more flexible, so we don't patients don't show up or cancel because people are freaked out, and I'm not going to penalize them with no show fees or anything like that. And minimizing promotional cosmetic activities may backfire on social media. The difficultness actually is I've found is with staff, because I've tried to rehire or bring back 3 of my part-time staff, and none of them would come back because they said they're not ready. They're not ready yet. So we have a very detailed preparedness plans to reassure staff they're educated about it, and you follow the plan for patient safety, patient reassurance, liability risk. And then I would recommend start with a lighter patient schedule, because it does take longer to do all these things until everything runs smoother, and then you can move on. Those were the slides I had. So that was kind of a quick summary of that's basically taken from the document that we've been using, AAD. That we've been sending you.
Thank you so much, George. I appreciate it. I think that was one of the most incredibly timely things that AAD has ever done. It was a phenomenal thing. I've seen other formulations of that, but AAD's was extraordinarily succinct. It was truly a magnificent job. I'm not sure who we owe this to, whether it was your work or not.
Well, let's just say I spent quite a few hours working on it, but I do have to say the AAD staff really pulls them. As if you know, they are really good. They pull the material together, and then what you do is someone like me or some of the others then try to put it into a practical position, because they are not physicians, so then kind of go through it and make it practical. And you'll notice that we are very different from the facial plastic surgeons who have a 20-page document.
63.
63, sorry, there was 63. Okay, so I didn't even get through the whole thing. And that's great for a hospital setting. But if you try to do that in your real practice, you'd go bankrupt, because to do all those steps, you'd see 3 patients a day, and you spend $50 in disposables on every patient. So.
Well, great job. Thank you so much. I'm going to turn to Candace Spann. Candace is a practicing dermatologist in Las Vegas, Nevada. And Candace, I know that did you have anything to say first? I had some questions of you, but did you have anything to say just off the top?
Well, off the top, I think that George should be president of the world, because I think that things would be going a lot better if George was running the show. So I vote for you, George. I think I'll dive into the questions. I do want to just kind of bring you up to speed to where things are in Nevada and kind of on the rest of the West Coast. So we had a stay-in-place order that was set to expire Friday, May 1st, that now has been extended to May 15th. And of course, we will see where that goes from here. I apologize on behalf of Las Vegas for anybody who saw Mayor Carolyn Goodman's Lord, disaster of an interview with Anderson Cooper. That was so embarrassing. We are not all lunatics here. That being said, we do still have the shelter in place order. We have been able to reopen. In fact, today was our first day back at work for medically necessary elective procedures or visits. So what we have done to acclimate to this is that up until, so last week what we had was we had accessibility. We had one doctor in the office each day for emergencies or things that couldn't be handled on telemedicine. Every other day, that doctor would take calls or patients via telemedicine, and we were closed on Fridays. We thankfully did, thanks to George and everybody at the AAD, we did receive the Paycheck Protection Program loan. So we are back open full time today. However, what we have is each doctor in the office 4 days, and everybody is still offering 1 day of telemedicine for any patient who does not feel comfortable coming in. We certainly don't want anybody to feel pressured, especially, well, for any reason, whether they're high risk or not. A few things that we have done, and some of this really reiterates what George has said already, is we have given each of our employees 4 N95 masks since everybody is in the office for 4 days. And so we have 4 N95 masks, and we also have 4 brown paper bags, each with the day of the week written on it. So if you wore the wet mask on Monday, you put it in the Monday bag, you don't get back to it until the following Monday. So that's just a way that we can safely continue to reuse the masks, knowing that the virus, if it's on there, has died. We are using either, if you don't wear glasses, then everybody also has either a face shield or they have goggles to wear. We have gone hyper vigilant, and I'll show you some pictures with our sterilization techniques and wiping down of everything. And I'll show you some pictures towards the end. To specifically answer your questions, and I'll read the questions first, I guess. The first one says, especially given the invasive and elective procedures conducted in your practice, what additional safety protocols and procedures are you implementing? Are you metering elective procedures, etc.? So because the stay-at-home order has been extended to May 15th, at this point we are doing no cosmetics, only medically necessary elective procedures. So we're back to doing our head-to-toe exams and biopsies for basal cell carcinomas and things that wouldn't necessarily be pressing. When we do reintroduce, what we've decided to do is to take a gradual approach to reintroducing our cosmetic procedures. So we will start first with medical procedures that do, cosmetic procedures that do have a medical benefit. We'll resume PRP, especially for patients who already had PRP in progress. We'll resume sclerotherapy, and that will probably be around the May 15th deadline. By the end of the month, we would start to get to things that are maybe more aggressive, but with less chance of requiring hospitalization. So we could go back to things like CO2 lasers, maybe even some Botox and fillers. And I think we'll probably be well into June before we start, of course, on my husband's side, the surgery side, before we start reintroducing things like facelifts or breast augmentations or anything like that. And even that guideline will depend on what the local officials, other than Carolyn Goodman, ask for.
And then Candace, I'm going to rephrase question 2, but just
Okay.
to ask you, have you had any staffing changes in the meantime? Has your staff remained employed, or how have you handled that?
Thankfully, we have been able to keep all of our staff employed. Between Couture and Retrust, we have 35 employees, and I know that's a drop in the bucket for you, Joel, but we are thankful.
Pretty sizable staff.
We've been thankful to keep everybody employed. We were getting a little nervous before the Paycheck Protection program, and we have actually shifted our business model. In fact, we were in the process of buying a new, larger office building and sadly walked away from that because we felt like we couldn't tell any of our employees, I'm sorry, we have to take your health insurance and your employment, but we're going to be in this really great building. So that was one of the, it really wasn't a sacrifice because they're doing so much to be there for us. So that's okay. And hopefully the building will still be there, and maybe it'll be less expensive when all of this is over. We'll see.
I think it's probably going to be.
I think so too. We have estheticians who were with our practice before, and the estheticians were working as medical assistants, maybe at the upper end of the salary for a medical assistant. And once they switched over to an esthetician role, then they were working on a commission based. And so what we've done since we've taken away all of that potential is we have put their salary back to the salary that they were earning as an esthetician, since we're employing them more as an esthetician right now. Anyway, everybody else who works on for a percentage of their production, that has stayed the same, and they've certainly understanding if their productivity has gone down.
And then, Candace, I'm going to ask you just to rephrase the fourth question. Have you noticed, and this is, you don't have to say anything that is particularly personal, but have you noticed any challenges with health and emotional well-being of your staff?
Most of our challenges, I think, have come from our staff in Las Vegas is in a unique position in that we saw, you know, maybe even 1 million people get laid off right off the bat because of the closure of all of the casinos. And so there's been a lot of worry, and that's where our commit to our staff came from, that, you know, their spouse or their loved one is unemployed. Are we going to be unemployed? How are we going to do this? So we do have something, we provide 100% medical insurance for our employees, and through our medical insurance, we offer something that's called the Life Connection. And this is 365 days a year. It's just something that we've been utilizing perhaps a little bit more. And this is a program that provides psychiatric care if you need it for anxiety and depression. If you have, you know, emotional stressors like this, you need to talk to somebody, it makes that available. If there's loss of a loved one, anything like that, we can support our employees through this program. So that's something that's nice that we've had available forever, that I don't think anybody's ever used, that suddenly people are needing to use some.
That's so incredible. And then lastly, I'm just going to ask, how is Marvin, are there any things that Marvin's practice is doing that we can learn from? As people may know, Candace's husband is a plastic surgeon, and they've practiced together.
So I think Marvin right now would probably advise any plastic surgeon to marry a dermatologist, because, you know,
wise idea.
Right, exactly. A lot of what has been keeping him busy has been referrals from derm for the huge skin cancers that need grafts, or, you know, I don't need to do an excision. He can do the excision and I can see, you know, more patients, something like that. He still is doing I think Marvin may do more breast cancer reconstruction than anybody else in Las Vegas. And so he's still doing, you know, the medically necessary, you know, mastectomy to implant, that type of thing. But he's been around a lot. So I think he's really looking forward to this gradual introduction back into practice.
Well, he's great. He's a great guy. So yeah. Thank you so much. And we will be back to you, but I'm going to segue on to Suneel. And so the first question that we had for you was, how do you plan to handle drug reps coming in the office?
I'm glad that you asked that. Actually, an attendee also asked the same thing. What's our policy for seeing pharma and sales reps? So, you know, in our practice right now, I'm very streamlined. I want to make sure that we do a great job taking care of our patients on time. So I don't, unless somebody schedules an appointment with me, and that's usually before hours or after hours, I'm not going to see the pharmaceutical rep anyway. For those reps who want to be seen, I always ask for an agenda. And I think this is something even going forth. You know, I want to support pharma. I want to support all the industry that's out there, but I want to make sure that it's an efficient meeting for them as well as for me. So if it's a sales call, I can go in expecting it's a sales call. If it's an educational call, I want to be prepared for that as well. So right now we have just, like Candace said, we were able to open up, not this past Wednesday, the Wednesday before. We did a very, very slow intro. We didn't do anything that first Wednesday. The next Thursday, we saw one patient, and honestly, it was a disaster. And it was a disaster because of me. So I take full brunt of it. I'm a pushover. I think most people that go into medicine tend to be a little bit more lenient when we talk about our patients. So I was there, the staff wasn't ready at the front door, so I let the young lady in, and she was poo-pooing masks in the first place. So I got reamed. So we canceled the patient that afternoon. We were going to do one in the morning, one in the evening. I canceled the patient in the afternoon, and we rewrote everything. And if you jump on our website, it's just Refresh Dermatology. You'll see a 2-minute video that we shot after that first patient to show what the person's experience is going to be. We've also given that video to each one of our pharmaceutical reps, but those reps, I'm going to do a televisit, right? Unless they have something that they have to physically give me or they need to share something with me, I'm going to do a televisit. I think it's going to be more efficient anyway.
Absolutely. I think that's a great idea. And then did you have anything you wanted to start off with about how the state of Texas is right now?
Texas, like George said, we're a little bit crazy. So I'm going to share with you, we were actually fully shut down from all procedures, and the TMB, the Texas Medical Board, said they were going to come in and they were going to take our license for 6 months minimum and fine us as well. So we were officially allowed to see non-essential, non-emergent patients starting, I said, about a week and a half ago. So it's been different. So we have been, had a great opportunity to do several things with our staff. I think it was a great opportunity to educate our team. I've been on webinar after webinar, learning from all of you guys, learning from our other colleagues, and learning from the pharmaceutical companies like you described. And then we got our protocol down. And it's interesting, if you guys have not restarted your office, there's a lot more involved than I expected. And if anybody wants, just email me. It's just Chilukuri at Refresh Dermatology, and I'll send you our protocol list. So it's a step-by-step thing that we've now implemented. Somebody had asked, what do we do with the N95 masks? Do we have to, do you give them 4? We've done something different. I actually give them 1 per week, and then we bought a UVC sterilizer, it's a UV sterilizer that according to the infectious disease, there's 3 local infectious disease experts that say this should kill off the coronavirus as well, based on the particulate size and whatever the heat mechanism is. And same thing, I'll be happy to share that as well. I'm going to share my screen just for a second so you can see this was what our first day looked like. It was a little bit different. Let me see here. No, let me see if, did that one come up? Okay, here it goes. Oh, that's not the right one. How about this one?
Yes,
oh.
Perfect.
So, and you can see there's appropriate social distancing. Everybody's at least 6 feet apart. This is the entryway. And now right where Maya is standing, there's actually a lock. So that's locked. There's a Ring doorbell here, which we can see as soon as there's a motion detection, so we can let them in. And we sent this out to everybody, and we put it on our social page as well. So these are our 4 aestheticians, our nursing staff as well, and reminding patients why. Because that first patient that came in, she completely refused to wear a mask. And it was just an interesting thing. And I said, okay, for the future on, we're not going to be able to do that as well. Anyway, that's where we're at now. For seeing patients, this is what I wear. I put that on, and just in case you don't know what it is, it reminds me every day. So we'll put that on, and then I do wear an N95 mask, and I've got 2 different types. We finally got some actual 3M N95 masks, and again, somebody had asked, have we gotten our team fitted? I don't know. I never fit properly even when I was a surgical resident, and so we don't have access to somebody to fit. We also have these 3M N95 masks, and they just go on, and just like a regular surgical mask. The only problem, honestly, is wearing it all day. They slip off my ears, and I still have big old Dumbo ears anyway, but they still fall off. So if you're going to be wearing a mask all day, which we've encouraged our team members, see if there's somebody in your local community that has a 3D printer, and they can print out a little thing that's about this big that you can hook the mask onto so it doesn't rub against your ears. And we've been seeing patients for about a week and 1 day, very, very short days, just like George said, really a true reintroduction. So we started with 3 people a day, then 5 people a day. And today we had a banner day of 11. And to give you a general idea, we see anywhere from 30 to 35 between our aestheticians and me. So we're at minimal capacity. But again, just like everybody has talked about so far, it gives us enough time to properly distance and work out the protocol. And again, I'll share that protocol with you guys because it shows how we sterilize the room and nobody's touching anything.
That's so smart. So I guess the next question I'm going to ask you is just, how do you reconcile your desire and frankly, your need to shorten the visits with the patients. Have you told them? Because there's always this constant concern. Are we relating the fact that we really want to decrease their time in the office to them?
Correct. So I had a hard time with that. Our 4 team members, they had encouraged me to have our practice concierge, when she calls to remind patients about getting in, that, Suneel's not going to talk to you as long. And I had a hard time with that. So I did the opposite. I just extended everybody's time frame. Normally we book 30 to 45-minute appointments for everybody, even if it's a follow-up. And we've now extended that we had extended it to an hour and 25 minutes, and we're working our way backwards. So we're at 50 minutes right now. Even the follow-ups, they are taking shorter and shorter. I think people, as they're starting to come out and about around town, they're not going to need to talk to you as much. But right now, that last week, everybody just wanted to talk about the situation, what's going on, what did we think? Some people are asking our medical opinion. Do we think this is going to come back again in the fall? So it's been interesting. So I have not been able to do that, but I have heard of practices saying you're going to have this defined amount of time. But again, it's going to be a personal decision, I think, on that.
And then the question is, you just brought it up, what about the fall? Do you think this is coming back?
I do. I think that I'm hoping that it's going to be more controlled. I think if, it's embarrassing to see how many people don't wash their hands properly. I'm like, you filthy animals, where did you come from? Right? And, this is nothing new. And I think if people will continue to wear their masks, and I've seen a lot of protests in Michigan. I think George, his town might have had a few of those protesters. Like I said, we had the first patient that we saw was definitely a protester. I carry a mask with me. If I'm sending my parents out for anything, I know that, yes, George, you're right. We may not know if the N95 actually works or not, but it makes me feel better. And so I send them out with an N95 and a face shield, and they're in their late 70s. Again, I think if we properly socially distance in Texas, where we're widespread, I don't think it's going to be as much of an issue. I do think, and I'm going to defer to Heidi to see what she says is going to happen in New York. And
then the other question is, have you implemented telemedicine within your practice during this time?
And so it has been absolutely a game changer. And I had the opportunity to talk to Natasha about this before we started the call. And it's something I never thought that I would do. I never thought that patients would want to do this. I stopped seeing new patients in October of 2016. So we've really limited who we can see. So either somebody has to leave the practice, somebody has to move out of town, or they have to die. So there's only 3 options. So when somebody leaves our practice, then we have the opportunity to bring somebody in. And for the first 2 years, 2017, 2018, you had to have 1 word-of-mouth referral. And then in 2019, you have to have 2 word-of-mouth referrals. And it's like a country club, right? Because you're part of our family. With telemedicine, because we weren't able to see anybody, I got to do my first 3 real derm cases in I don't know how many years. I caught 2 zoster cases, and one was a type 1 histamine response, which was interesting. I'm like, okay, get out, go to the hospital now, because it was an 88-year-old woman who didn't want to go to the hospital. But what we've seen from the cosmetic side, patients like to talk to you. So now I've seen 3 acne consults on 3 acne scar consults on average for each week that we've been out. We've been out for 7 weeks. I've seen 1, 2, 3, 4 body contouring consults. Again, it's not huge numbers, but it's just enough. And what I've discovered is those patients who want to come for skincare, whether it's for fine lines or for wrinkles or for just texture changes, it's a great opportunity. And it gives me an opportunity to weed them out. So I think for me, it's qualifying who we get to see.
Thank you. And then somebody asked you to repeat your email address, please.
Certainly. It's just my last name, Chilukuri @Refresh Dermatology. And then for Dr. Ravitsky, if you send me an email, I'll send you the UVC sterilizer that was recommended to me.
And then there's a question about whether we have any change or any ideas on pregnant staff members and what to do to protect them.
So I am going to roll with what Dr. Hruza said. There's a reason he was the president and I'm not, and I never will be. It's because we don't have any guidelines on pregnancy right now. So I agree with them. It's see what the OB-GYN recommends, see what your staff members' comfort level is.
Very good. Well, thank you so much, Suneel. And we are so excited to have Dr. Heidi Waldorf with us. Heidi has been at Cosmetic Surgery Forum for at least, I think, 6 out of the 11 years. And she's all consistently come back as one of the top rated speakers, and she is that for a reason. So Heidi, thank you so much for being here.
Hi. So I guess I'm hoping, can you guys hear me? Are my ear pods working? Okay, I'm wondering how I'm listening to people. So first of all, I'm coming to you with a little different background than everyone else here because I'm in the epicenter. My office is about 20 miles outside of Manhattan, but we're not upstate. We are down in that little corner, that little triangle. And I actually live in Manhattan, and the only reason I'm not speaking to you from Manhattan right now is because my apartment was under construction. Before this, you're seeing a photo of my apartment behind me, and when it's not under construction. And so I have been out in the suburbs living at my dad's place, which was a blessing because quite honestly, had I been going in and out of my 400-unit building and having garage guys in and out of my car, I would not have been able to see him and his wife and be part of this out here and do their grocery shopping and such. I have a tentative reopening date of June 1. So that's number 2. Tentative reopening date of June 1 because Cuomo, who has been an amazing governor during this period of time, is basing it not only on 14 days of going down, but also having 30% capacity in our hospitals, which I think is critical. So because the reason we had to close in the beginning was because we were not prepared. I did an Instagram live on Friday night with a dear friend from Korea. And why were they able to keep working? Well, they had had respiratory epidemics before. The minute this started, they knew what to do. They had ventilators, they had masks and everything. So thankfully in this area, we're not seeing protesters. And I will tell you what I would do with protesters. Don't let them in your office, because the point is you don't let people in your office. Like I don't let dogs in my office. It's a doctor's office. We've got rules, and it's your office, your rules. You can't play the game if you're not going to follow the rules, you know, and it's public health. And I think about this like seatbelts or helmets. I was at the grocery store last week, and there was a 40-ish-year-old woman without a mask. I said, you know, you really should have a mask. Oh, on my way in, I forgot it. Well, guess what? You got on your bike without the helmet, go back and get the damn helmet. That's a given. So it's your office and it's health. And it's not only their health, it's health for every other patient and your staff. I don't even see my slide. Supposedly there was supposed to be a slide here, but I'm not going to worry about it because well, Natasha, where is Natasha? There was supposed to be a slide she was putting up with my outline, but I guess I could find it but I didn't know to find it because she was
I have it here.
Yeah,
I
that's
just wasn't,
great.
I was just
and
waiting
I apologize
for you.
to you guys. Thank you, Natasha. You are awesome. Where is it? How do I see it? Let's see. I apologize that I gather it's pixelated. It's something I used from another symposium on this topic. I don't see it. There it is. Can we make it a little smaller so it's okay? Well, it's pixelated, but ignore it. It's giving me the outline. Now, you've heard a lot of these things from George. And again, I think, I really think that this was great that they put it out. I do think that if you are doing aesthetics, get a copy of the Jeff Dover article that was in, that's in AAFPRS's journal, because that gives recommendations. You don't have to read the whole damn thing, but the charts about aesthetics. And here's the other difference with the other people. I guess it's like Suneel usually is. I'm not doing telederm. I don't do general dermatology. I don't do biopsies. I am an aesthetic dermatologist. I see some acne, I see some rosacea, but otherwise it's aesthetic. So when people say, are you going to inject? Of course, if I'm opening, I'm not opening until I can do what I do. Other people have said, well, maybe I should just treat the top of the face and keep a mask on. That's a disservice to your patients. So if you're going to do that, don't be doing it, because it's a disservice. So you have to be prepared. So you've already heard that you have to the federal and state guidelines, number one, and you have to update your standard operating procedures. As one dear friend, Brooke Jackson, said, she felt like she was opening new practice with all the paperwork again. So make sure that you review your standard operating procedures, your SOP for your office, and write out an additional SOP for COVID. In terms of the physical office, I recommend, well, if you can before you start, but you guys are already starting, walk through your office. And this is what I'm recommending over here you do. And I apologize, it's not that visible. Physical distancing, that's for your staff also. So if you have 2 receptionists normally at a desk, you may have to move someone or stagger their schedules. Decluttering, that is huge. This is not just about taking the magazines out. You got to take the magazines out. But also, I have a coffee table. I love my big coffee table. And it has books I've collected from around the world. It has books friends have written. They are all going away. Make sure that you have nothing, even your pretty objets that are out that cannot be wiped. I have a globe. I'll leave my globe out because we can wipe it with a Sani wipe. Our beverage center, gone. Our beverage center, beverage and snacks, gone. Our little bowl of Hershey's Kisses, gone. Actually, a friend just from a friend of mine from the Middle East just recommended handing everyone a chocolate on their way out. That can be their little prize because they can't get it on the way in. Sanitizing, you've heard a lot about, and if you don't know what hypochlorous is and you haven't used, there's a company, it's Sonoma, makes LaserSyn. It's more expensive than chlorhexidine, but it's excellent because it's not a danger to eyes or ears. So over a decade ago, when in my past life as a Mohs surgeon, I used chlorhexidine. But now when I'm prepping faces and I'm prepping bodies, I use hypochlorous. So we'll use more of the alcohol-based things, the Sani wipe for stuff, and we'll use for skin, the hypochlorous. That's what a lot of the facial plastics folks are using to rinse out noses, or thinking about it, because ENT has the highest rate of getting COVID from patients, as well as mouths. And so again, I jumped ahead, but sanitizing, air quality. I just bought, because again, I'm thinking of the office. I've done the decluttering, let's say. It's also a good time, if you have boxes like we all end up with in our office, this is the time to get someone in your staff to get rid of those boxes, because any extra boxes and paper is another place COVID can sit. So get rid of the clutter in every space. That's hard for me. My own office is lots of clutter, but I'm the only one in there. Air quality. I have purchased for each exam room an air circulator. Now, you may not need that, but like Suneel, my regular patient visit is 40 minutes. I'm in there with them. And my other visits are long, and lasers have plumes, and I'm right up close. So the ones I ordered will circulate the air 15 times an hour. 12 to 15 times an hour, and OR requires 10, I think, to 20. I don't have an OR, but I have 8 by 10 rooms. I want that air circulated, and it takes the air, puts it through a HEPA filter, UVC, some ionic thing, and carbon. Now, do you need it? Maybe not. I want the extra for me and my staff, just because my HVAC system is not great. And I know that. I can't add a HEPA filter for my HVAC system. Right before this started, I was supposed to have them go in and redo my HVAC system. That's not now. So that's something I am doing. So look at your space and how you utilize it. Maybe if there's a room that you do something, maybe get something like that for a room where you're doing DNCs. I'm not doing DNCs. But even if you're not doing, let's say you don't get a HEPA filter, make sure that smoke evacuators, I mean, God, I hope you have smoke evacuators anyway, that you have those. Someone's asking the name of the air filter. The company, they're going to be distributed through Henry Schein. If anyone has a question for me, just DM me on Instagram at Dr. Heidi Waldorf. I don't check my Facebook a lot, so just at Dr. Heidi Waldorf on Instagram. But that's the air quality issue. Or you may have windows, you may have great circulation. You may be in Omaha or Vegas where there's lots of space, or Texas. These are big states. So now your staff, whatever you do in terms of who can work, who can't, check your state Department of Health. We can tell you whatever it is, but State Department of Health has certain rules, as does OSHA. So that's the other thing. Rewrite your OSHA policy or write an addendum. Because when you think about this, it's no different than HIV, except that it's everywhere. So I'm old enough to remember when we switched dentists as a kid because the dentists weren't wearing gloves. And my mom's like, we find a dentist that wear gloves. And it was just starting universal precautions. So we have to assume that patients are positive and we want to protect ourselves and them. So with OSHA, in your OSHA, if you look at the federal OSHA guidelines, they divide people into low, medium, and high risk. And that's what you have to define your jobs. Now, I do disagree, George, I love you. I think you're brilliant, as you know, but I do think that we do have data that N95 masks work better. And they're N95 masks in the US, Asia are KN95s, Europe are, I wanna say FS22s. I don't have the fitted ones. I have the ones that fold, and frankly, they fit quite well. A little trick for the ears. On Etsy, they sell those little doohickeys. Same with the 3D, you can make them the 3D printers. But if you have a croaky, Jim Broading, a plastic surgeon, showed me this. He took in his croaky, you know, for sunglasses, he put a paper clip at the end of each, put the paper clip to the ear things, and stuck the paper clips in the croaky, and it worked because then you could just tighten it. I purchased on Etsy for $6 each a little doohickey that works similarly for each of my staff, because those plastic ones with the hooks, my head is too big for them. I measured, they're 6 inches and I don't have 6 inches there. Now, schedules, if you have, I only have me and my staff, I have no other doctors. If you have more than one doctor or you have a lot of staff, you may want to alternate, make team A and team B. And if they can't be in different parts of the office, you may want to alternate their schedule, because then if one person on a team gets sick, your office isn't shut down. If team A has to go into quarantine for 2 weeks, team B is still working. Add to your responsibilities, your written responsibilities for each staff member, who is responsible for sanitizing what. Our bathrooms are one of the highest areas because COVID may be eating stool. So bathrooms are a big issue, and make sure that everyone has responsibility for cleaning it themselves after they go in your staff bathroom. But your patient bathroom, you need to assign who's going to be using it. I agree, it's also one patient in the office at a time, no family members. I have no idea how this is going to work for our patients this summer when there is, there's no camp, just like there's no school. In terms of that, you've heard about teledermatology, extending the schedule. I would also agree, and I forget who said this, but I think Suneel, you may have said it, communication. I feel very blessed that I have extra time, but a number of my colleagues, our colleagues from elsewhere in the world have done this, and some of them in the US are doing it, have done it, and Suneel just mentioned. Make a little video of what it's going to be like and what the expectations are for your patients, so they know what you're going to look like. They know what is necessary. They know if they come in with a, don't come in with a mask, you're getting a mask. We're going to have shoe covers. I purchased a non-electric standing hand sanitizer unit with a foot pump for outside my front door. It's rust proof. We'll move it in inside. They'll have to wash their hands and do it again when they come in. Screening, I think the AAD thing is great and better than some other things I've seen. You must include not smelling stuff, not tasting stuff. Pre-registration, make sure all of that gets done before. In an office like mine where there's no EMR, that's one of our biggest things we're trying to set up, because we need a HIPAA approved way of doing that. On arrival, whether you're going to call, whether you're going to text in a HIPAA approved way, you're going to set that up. The visit and the procedure, again, I don't do general dermatology, so I will have a soft opening, but my soft opening will be cosmetic. I will because as you probably can tell, I chat and my patients chat. We chat, and it takes more time. One of the things we're going to have to say is we are very sorry. We want to talk to you, but for your safety and our staff's, we need to limit the time that everybody's in a room. So we apologize about that in advance, so they know we're not trying to rush them. The exit, decide in advance. Again, are you going to have someone from the staff coming into that room and running the credit card? Are you getting a credit card in advance? Again, for my office, those rooms are so small. I don't want someone coming in the rooms. I want my patient going out. And what we are going to do is they hand the credit card, the staff will, be washing their hands well after. We don't hand the patient a credit card machine, so we don't have to worry about that. There are systems, in terms of just throwing this out there, there are some systems that you can upload your before and after pictures to, so that then the patient just scans something and they show up on their phone. I'm not for that. I'm not doing that because honestly, I don't want all my other stuff on their phones. I don't want to take a chance that someone's stealing my pictures elsewhere. So we're going to have it on an iPad, and then we are going to wipe down our iPads in between, because you can, and wipe down pens, etc. I have an office with paper, and you can't wipe paper. So we're dealing with those kinds of things, and that's why we need patients to send things in first, and we're going to have to figure it out. But in terms of these things, again, I want to focus on that middle part. You can have any policy in the world, but if you don't have documentation that you have trained your staff and they get sick, that's your liability. So have an OSHA meeting and make sure that everyone signed off on an attendance sheet, that they have attended and been trained. So that's going to protect you and make sure that they do a better job, because you don't want to have to close down your office. The things I think we still don't know and are still unclear, if somebody says, oh, I had COVID, how long after are you going to do a cosmetic procedure on them? Now, most of the surgeons are saying, well, they'll have 2 negative COVID tests, but is that what I need? How long after should I be waiting? How long after do we accept certain tests? We know that there are plenty of people out there who have had COVID who have negative COVID tests and then have antibodies. And we know there's also reactivation of COVID. So they could have COVID and not have any antibodies. So those are the things I think we have to roll with. And I will caution people from just buying tests and doing them right now when we don't know what the best test is. So that's my spiel. I wish you all luck who are already opening. And as I said, I am thankful I have a little under a month.
Heidi, somebody was asking, what's your air circulator? What's the
Okay,
name?
so that's what I started to mention. The air circulator is from a company. That's why I said people could write to me. I want to say it's called like Surgically Clean, but they were either purchased. I bought it a week ago or 2 weeks ago, and there's a 60-day waiting period. So since I'll get it in July, hopefully I'll open in June, and I booked, patients a little longer for that period for the first 2 weeks and then going back to more normal. I have decided anything that might have a plume, I'm not doing until I have those in the room. My understanding from them is that Henry Schein will be selling them. But if anyone is interested or wants to contact, please just DM me on Instagram. That's the best way to get me, at Dr. Heidi Waldorf. The other thing in the same thing, I'm glad you brought that up. How many people have Pronox? Pronox you can contaminate with the exhale. Pronox, if you have it, purchase from them. And again, if you need a contact directly with the company, just DM me, because there's a guy at the company, Carestream, who he's very quick about these things. They have little filters. You add that little filter onto your Pronox, so at least it's filtering the exhaled air. And you're not then contaminating your room and contaminating your machine. I will also recommend that you don't send patients home. I've known a few people who, to try to save money on the hoses, which is, to me, makes no sense whatsoever, because you're using them for cosmetic things anyway, sends the patient home with the hose. Chuck the hose after. One hose, one procedure, one person, chuck it along with the filter. The filters are not expensive. I forget how much they are per, but they were not anything crazy, and they're certainly well worth it. So I do recommend that. And the only other thing I think that was not mentioned, and even if you're back to work, depending on the amount of time that you've left, if you didn't do this already, I think it is worthwhile speaking to any of your device companies and asking them if they will extend your service contracts for the period that you were closed. I did that, and every one of them was willing to do that. And 2 months is a lot, or even a month and a half. And that is quite helpful. The other industry, our industry partners who sell us our injectables and other disposables have been, very amenable to helping us in terms of extending payment terms. And finally, I would say, I am not letting reps in my office. And I think the companies, frankly, a lot of us have spoken to the companies about that already, that they have to speak to the reps. They cannot come in. They should email you. I mean, I don't take cold calls in the office either, and neither does my nurse administrator. Let them call you, and you can figure a time when you can meet with them. Because as you've heard, you're going to be crazy busy in the beginning just trying to remember what you have to do. Last, I will say with the masks, their hydrofacial company is, and I have no financial interest in any of these, the hydrofacial company is making these TheraMask things that are, the science shows they're like N95s, even though they aren't, but they're washable. And so I purchased two for each staff member, figuring until they get their FDA seal as an N95, my nurses and I will have to wear N95s. We're going to wear isolation gowns, which I'm still looking for. We're going to wear hair coverings, N95 or KN95, and a face shield. Because we don't have a place for people to change in and out when they come in. Oh, and shoe covers. My front desk can just wear that TheraMask and the shield. And they don't need the hair covers, but I am going to have them wear isolation gowns. They will be able to repeat their isolation gowns. We're not going to. So that's Heidi, my addition.
So Heidi, I have a question. Once you get started, do you have any concerns about procedures such as fillers that would bring you close to that patient's face?
That's what I just said. Everything I just said, that's all I do, Joel. I don't do general dermatology. I don't do everything else. So everything I just said was based upon that, the PP and everything. And that's why I started out by saying, I'm not doing general derm. I'm opening when I can open to do everything. The only things I will not be doing at the beginning are things that have a plume, which I am waiting until I get those air recirculators. But I'm not going to just treat half a face. I think that's a disservice to the patients. I think we're going to, there are a lot of issues in terms of what patients' needs now and all of that, but I'm definitely injecting because that's what I do. That's 90% of, I would say that's 95% of my day.
Okay, now question for the rest of the panel. Any thoughts on people who are anti-vaxxers? So people that might not get a flu vaccine or eventually a coronavirus vaccine?
Well, a flu vaccine, who cares? I mean, that's their choice, because if they're sick, we tell them not to come in because they might get reactive. Frankly, if someone gets their flu vaccine, I won't do injectables for 2 weeks before or after. But when COVID comes in, once we have a vaccine, we may adjust. I mean, I can be quoted on this, F the anti-vaxxers, but.
Thank you. There are a couple other questions. George, have you heard anything about the UV sanitation lights and a particular brand to help with this?
Well, unfortunately, I can't help you with the brands on UV sanitation, UVC. I know Henry Lim's group did a nice paper on successful use of UVC, and there are now several available out there. The only thing I would caution you is that some of the masks with UVC will break down. Some of the elastic material will break down, so you do have to kind of see if your mask works. Just like I tried to steam autoclave one of my N95 masks and it came back as toast. So it was not something we could use again. I would like to go a couple of things that Heidi mentioned about N95 masks, because I actually do like them. We do use them, but of course our PPE preservation process, so that we're trying to preserve PPE, so we don't want to use them unnecessarily. And the science on them is, some science is there's a benefit, and that's why I use it in high-risk procedures. So in our office, if you're going to work around the mouth, which of course you will be most of your patients, I think it's important for all the staff to wear N95 masks. It's just that if you're working off the face and the patient has a mask and you have a regular mask, then I think you're okay. That's kind of my thinking on it. I would suggest that the air circulation, I know there's the plastic surgeons love it. They're excited about this air purification. I would have to say that that's one area where there's very little science to say it makes you feel better, but it's very little to tell you that actually you're.
But don't you think, George, don't you think it also has to do with your room? And I know that my rooms have a history of poor circulation, poor air circulation. So that's why I prefaced it by saying, if you have good air circulation, if you're not smelling aromas, you know, for an hour after in that room, you're fine.
Yeah,
but
right.
for us, we know that that's a problem in my room. So.
Well, just so you know, you guys can all talk to an HVAC company. So whoever you use to service your air conditioning, or you can talk to the building owner, because that's if that's part of your triple net lease, if you have a triple net lease.
And if you are your building owner, then you talk to yourself.
I am.
Yes.
Right.
And me too, right.
Yeah.
But
Yeah,
if you're a building owner, it's even easier, because you can talk to an HVAC company that can come in. And when we built out our space, we actually have 500, it's 5 times the entire air exchange per hour.
That's fantastic.
It's 1 time more than what goes in an operating room for an orthopod. So again, you know, you can.
So you don't need it.
Well, I don't need it. Not just that, but inside our HVAC system, we actually have a some type of UVC filter or something like that. So you can talk to the HVAC people. And somebody had asked, I think Dr. Potskin, somebody had asked, I don't see it. Okay, is there an air purifier? I've heard they do not prevent coronavirus. I don't think it's necessarily that it prevents coronavirus. The question is, can you recirculate that air out of there faster? So I think it's just one more precaution.
And they actually, the filters are small enough to the filters catch things small enough to catch, you know, presumably to catch corona, we think, according to what they're measuring. But again, this is in an older part of my building. Sure. And I know I have issues. If you have no issues and you have a building with build out and you have a good HVAC person, it's much more cost effective to do this within your air. So we all have to do, you base on what they say it's a minimum, and then you add to it for your comfort, your staff's, and elsewhere. And the other thing that was being said about pregnancy, there's no evidence from the China literature elsewhere that coronavirus causes any particular risk to the fetus. However, I agree, again, this is an OSHA issue. This is more of an issue of liability. So make sure you're checking with have your staff member check with their OB. Same if your staff member has had leukemia or is on an immunosuppressant, you should not be the one making that decision. You've got to defer, and they may need to go on disability. Because remember, that's different.
One of our physicians, I'm sorry.
Yes, Candace.
I was going to say, one of our physicians is actually a cancer survivor. He had head and neck cancer, and we have asked him not to come back until this is clear. And he's older and he's fine, and I think he more is there to entertain himself anyway. But I just didn't feel that I could safely have him in the office, even with all the measures that we're taking. Joel, could I switch real quick and just come back to a couple of things that people haven't mentioned that we can see? One thing that we've done is we've tried to really go to non-contact as much as possible with the patients. There was a mention of maybe switching to non-contact payments. We actually were quite easily able to update our care credit link, and we added a metrics link, and that made it very easy for patients to pay without us having to take or bring in a card machine. We also have a personalized link from our merchant services company, and so Dr. Logic is going to help us to put that on our website. So will be 2 ways that people can pay without having to touch anybody. Means having plexiglass windows, and I do have pictures if anybody wants to see, or I could send them out. But we have plexiglass. We've actually marked spacing on the floor, so there's no question about where to stand. And everyone in our office waits in their car until they're called and they're brought straight back. A couple of other things. Right now, our office is all digital anyway, but we don't have patients signing consent forms at all. The MA signs it. Oh, here we are, just showing you some pictures. This is checkout. So we created a separate checkout, so there really is no need for anybody to be in the waiting room. And you can see that there's a plexiglass window there. On the plastic sides, patients who need to schedule whatever, you can see that everybody socially distanced, and there's the plexiglass separation that's in place now. Please, Natasha.
And thank you so much, Candace. We have, pardon me?
Everything's totally, I'm just showing you here that all the cabinets, there are no gloves, there's nothing, everything's been cleaned and put away. That's fine. Oh, and the time, actually the clock is maybe a spot that people aren't thinking of. This is going fast. On top of our time clock, we have alcohol wipes. So
sorry,
everybody,
Candace, I'll get there.
no problem. Everybody wipes the second that they punch out and wipe again before they punch in. So you can see we just laid a ton of alcohol wipes everywhere so that nothing should be touched. The sign that was on the front door really reiterates what Heidi said, and that shows, if you go to this, it's larger. The first sign is of a woman or a person who's on a mask, and it specifies that nobody will be allowed in the facility without having their mask on. So at that point, they've heard it. Here it is. When we book the appointment, when we confirm the appointment, and then when they get to the front door, before we allow them in to check their temperatures and all of that, they're seeing this. So there really can't be any question about whether or not they will be admitted without a mask.
Thank you. And I'm going to say a few things about what we are doing in our office. So it sounds like we're probably the most medical of the practices here. We see about 60% medical, 40% cosmetic patients. So for the past 6 weeks, we've been doing telemedicine, and currently we are seeing about 40 patients telemedicine a day for our practice. That's among myself and my 2 PAs. Now, those 40 telemedicine patients are anything ranging from acne to psoriasis to potentially some follow-ups of skin cancers. But basically, the goal here in our office is to screen as many people as we can before they get to the office in order to opt out people from seeing us. So my approach to this, as a germaphobe and somebody who wants to keep our office as safe as possible, is to keep as many people away from the office as possible, both during and after the COVID scare. So, for example, if I can get a person to be seen telemedicine and keep them from coming in the office, or limit their time in the office, that I think is a good thing for both myself and my staff. I think that what we have to do, if there is something, is to look at this as the potential that everybody who comes in the office is a concern. So, for example, let me give an example. A person called up and she says, I'd like to have an appointment to be seen for a mole. And we did screen her via telemed, and in the process found out that she works in a nursing home. And oh, by the way, somebody there was just diagnosed with COVID. And so we said, this is unfortunate. We will probably have to wait until you get through the period of your quarantine. But had we not, we would have found that in the office rather than during that call. Now, it's going to be important for the staff that is making those appointments to check and make sure that people are free of COVID or have as few risk factors for it as possible. But to Candace's point, we screen everybody on the phone. When they come in, they don't make it into the office without having their temperature taken. We have somebody stationed in the hallway. When they come in, they are not getting into the waiting room without having their temperature taken. and without being asked the questions again as to whether they have any risk factors, whether they've lost their sense of taste, whether they've lost their sense of smell, whether they've been feeling well, etc. So it's going to be a long process in order for us to get back to normal, but I think it's absolutely imperative that we make our offices as safe as possible and keep our staff and ourselves as safe as possible by doing that. Last and not least, I think that once the people are in, I do take a little bit of a different view on how I'm interacting with those people. I assume everybody is COVID positive, despite the fact that they're not. And so really when they get in there, I almost am either rightly or wrongly feeling like the clock is ticking when I enter that room. I don't know how to explain it fully to patients, but we have a lot of interactions. The longer that we're in that room with the patients, if that patient indeed has COVID, the longer we're being exposed to those patients and potentially getting COVID from them. Now, that doesn't mean that we can be rude, but at the same time, I think that some of the chit chat that we may have normally done may have to go by the boards until we have an answer to this. Now, that may be a little bit more understandable if the person is medical in nature, but on the other hand, I think that we have to be careful and we have to protect ourselves. To Heidi's point, I think that there is a concern that when people take off their masks, there is a risk that we're going into that we might not have if they remain with their masks on. So there may be the chance to screen a person and have a biopsy on the forehead where they can wear their mask the entire time that they're in the office. But if they have a lesion on the lip, it's going to be a different story. And again, that clock starts ticking when they take that mask off, or we just say they're not going to come in until this crisis is over and put those biopsies off. I think there's going to be a different calculus for everybody who is in this process. So I think we're all going to have to, consider it. So, and as far as Candace's shields, I think that's a great idea for the time clock. There are some biometric time clocks where you can look at them. They don't work all that well. We had them for a while and we threw them out. But there are ways that you can do it other than through a time clock. And I think there are a couple of questions I'd like to go through. A couple of shout outs to you, Candace, and your door sign. It was great. And I think that there is going to be a video tomorrow morning that we'll be sending out so that you can look this over, as long as the Zoom gods are kind and let our videos work. Last time they didn't. And then there was a couple of questions. What about skin cancer screenings, Joyce Davis, where masks need to be removed to examine a patient? And I'll send that to you, Suneel, the Mohs surgeon, Mohs doc here.
Well, I think George has definitely more experience than I do, even though he looks younger than me. But I do. We'll take off their mask, but I have been wearing a face shield and an N95 for every single patient. I know that our local society and I think CDC has recommended just a typical surgical mask unless you're working in close contact less than 6 feet. So I would still put a face shield on and and personally wear an N95.
Well, yeah, I mean, since you're within 6 feet, obviously, because you're examining them, so naturally we actually do N95s in our office. If you have them available, that's the way to go. And everybody in our office has eye protection. And actually, the reason is not as much for the splatter, but it's actually so you don't keep touching your face. That's actually a big reason for that. So we have some face shield. We have the eye shields for the front office, but for the nurses, they tend to wear safety goggles. But people can choose which one they want. And the one other thing is, we used to in the past, I would not always have gloves on when I would touch a patient, and of course now we have, gloves on or any touching patients.
George, what do you feel? What do you feel about if a patient gets sick with COVID? Could we be liable, or worse yet, if one of our employees gets sick from a patient who has COVID? Is there going to be a consent form that you think we should use for any patient coming in the office or any employee?
I guess I would ask, do we, when you go to the supermarket, or when you pump gas, do you sign a consent form before you go in there? Or now or later when stores open, when I go to Lowe's? No. So I don't think you really need a full consent. I know plastic surgeons, a lot of them are doing that. But what we are doing is along the line that, you know, that you saw the sign, and you'll be getting one tomorrow, and I was reading on there. We do kind of we thought giving patients an understanding that there is always a risk that they could be exposed. And I think as long as you take reasonable precautions following CDC and OSHA guidelines, you don't have to go to those crazy ones, but if you follow those, then I think you should be okay. So I really would not get too worried about that. The other thing is, the other question that was raised is, well, what if you find out a patient that you saw, they come down with COVID-19, you know, 3 days later, and then not because that they're accusing you of something, but then what do you do? Because now your office has been exposed to COVID-19. Well, if we're taking all those precautions, especially the masks, most important, and the cleaning and all that between patients, I don't think it means you have to shut down. And that's been kind of looked at by some of each health department has different rules on this. But the approach is that the one place in Indiana, what they did is they said, as long as both the patient and the staff member had a mask on, then you're okay. Or if the staff member had an N95 mask and the patient didn't have a mask, then you're okay as well. So in that case, if the staff member only had a surgical mask, patient didn't have a mask, then they might shut you down. But it depends. Each department, each place will decide on its own how they're going to approach it.
And for those of you guys who are having a hard time finding some of the PPE, don't forget to look at your local hardware store. So we bought the clear goggles for our entire team. I think they were $4.99 or maybe $6.99 from Lowe's. And so you can get things like that. You can get it's an N95. It's not the medical N95. They also have an N100, which is really hard to breathe out of, but they have masks because we use them for painting and for things like that.
And
Also,
I'm not sure if Jerome Potoskin is on right now, but Jerome had a couple of good points. I'm not sure, Natasha, can you unmute him if he is available? It may take you a few seconds. Heidi, you had something to say?
Now, I was going to say the thing that helps us, that saves us in terms of employees, you know, someone said, I think you may have asked, can you have your employees sign something? That's actually, at least in the state of New York, not legal. You can't have them sign a waiver of liability. I think with the cosmetic procedures, we may want to add a little addendum saying that the effects of getting COVID after or having COVID when you have the procedure are unknown, because we don't know. And let's say we find out after. Patients call us all the time and they go, oh my God, I didn't know I needed a root canal. You know, things like that. We have more data on that. So just, you may want to include something saying this is unknown, but at a certain point, everyone's taking a risk with everything, and they're safer in our office than in the grocery store, as George, you know, implied.
Everybody's wearing masks. Jerome, are you unmuted?
I think I'm unmuted.
Great, we can hear you. Can you tell us what your point was on the scanner?
The scanner.
An app-based time card.
Okay, so we have we use our payroll services called ADP, and they have an app-based time card. So all of our employees have an app on their phone. They clock in and out on their phone, so no one else can clock in for them or clock out for them. And it's geo-fenced, so they have to be on premise in order for it to work.
Great, thank you. And then you'd had some thoughts on the air purifier also.
Yeah, so I think that the air purifier probably is something that makes us feel better, and probably makes patients feel better if they see that in the room. But I don't see any scientific evidence that will prevent the spread of coronavirus, and I've researched that myself.
But I think you're also, again, I was not suggesting this as a flat for everybody. I am talking about rooms where we may be having a plume and we want to clear the air faster. So I don't think anybody's really looking at that. It's not going to help with spit. It's not going to help with sputum. But if it can help clear the air of a plume from laser hair removal, from resurfacing in a small room where you don't have good air circulation, I think it can't hurt. So what I have been saying is not this is going to cure us, but I know for me, I want better air circulation. Air circulation is something I've been dealing with, and I want to clear that that plume. So I'm not saying everyone should get it. I'm not saying it's something you have to decide based on your office configuration.
You know, there is a HEPA filter that you can get at a place like Costco, and it probably is meaningless, but it's actually quite expensive. I think it's a Dyson, and it's $2.99. If Nancy had found one, I'm not sure if it's worth investing in it because it's pretty much probably garbage.
This is not HEPA. What I'm talking about is HEPA, but it's HEPA plus UVC.
Oh.
Plus, yeah, there's the air goes through HEPA filter, UVC, as well as a carbon, as well as some ionic things. So again, is this fabulous? Is this perfect? No, but none of this stuff is. We need the masks, we need everything, and you look at your office to decide the best way to do it.
Thank you. And then question for everybody on the panel. When, if you had estheticians, would you say it's safe for them to start practicing?
We will resume our estheticians seeing patients, and even their procedures will kind of be rolled out in the same order as our procedures. So right now it's definitely not safe for them to resume practicing. Maybe if May 15th comes and we are actually allowed to start reintroducing cosmetic procedures with them wearing N95s, maybe they can start doing chemical peels and some of the less abrasive lasering. But they'll kind of follow our lead. It's not that I'm going to turn them free at any point.
Do you feel comfortable with them doing a facial, an hour facial on a person at that point?
If I'm doing fillers that could take an hour,
exactly,
then I think that they can do an hour-long facial. Yeah, absolutely.
Great, excellent. And for the rest of the group, do you have any thoughts on people that you would screen away at this point, just in terms of their own safety, i.e., if somebody was immunosuppressed, do you think you would actively discourage them from coming into the office at this point, or do you feel it's their choice? Heidi?
I think it's their choice. That's something they have to determine based on their physician who is telling them, because that's not my responsibility, but I am looking at their safety with the procedure I'm doing. They are likely safer in any of our offices than just about any place else they go during this pandemic. So it's not my office that's the problem for them, it's the world. So it's more about
our phrasing. I was gonna say our phrase is, if you feel that this is a medically necessary something, or if you feel that you need to see us in person, we would be happy to see you. But we took the onus away from them for a long time because we had, a 90-year-old come in with skin tags the first day. So we realized that it was kind of our responsibility to say, let's slow this all down. But now that we are gradually reopening, we've put the onus kind of back on them.
The problem is non-essential. When everything you do is non-essential,
right,
it's non-essential anyway. And I'm not the one I'm just looking at their health as it relates to my procedure, not their health as it relates to COVID. Because I'm hoping I'm not giving them COVID. We have a higher risk of getting COVID from them because their masks are coming off. That's the concern. So I'm screening them to find out, do they have something that's going to come to me and my staff, or come into my office and give my office, contaminate my office? We're not giving them anything. It's that, in that way, it's like HIV.
Thank you so much. And I'm going to be wrapping this up, but I wanted to do a couple things. First of all, I wanted to announce that tomorrow, assuming that this records correctly, which it seems to be, we'll be sending this recording to everybody who's on the CSF list. I want to say that hopefully this year there will be a cosmetic surgery forum. We'll see. We're hoping, we're praying that by December everything is looking good in this world. And then I just want to ask everybody for their best guess. I'm going to go starting with Heidi and going through the list of when we return to normal. You won't be judged by your answer.
No, don't judge me. I'm judging everyone else. 2022. I mean, you're saying, I'm going to let you know already, I'm not flying this fall. And you know, I go to Thailand for a weekend normally, you know, but it is ridiculous to think that this is not safe until we have a vaccine. That's a given. It's science. So.
And testing, widespread testing as quickly as possible, and a vaccine. Joel, I don't know that we're ever going back to normal the way that we knew it. Honestly, I think that a lot of these changes that we've implemented may be permanent changes. I don't know, because right now it's COVID. What will it be next year and 2 or 3 years down the line? And what somebody said earlier, I forget, was that the reason that South Korea responded as well as they did is because they were prepared. Heidi said that. Hopefully we will never be in a situation again where we are this unprepared to handle something like this, because it's not the last time it'll happen.
Amen. Amen. Suneel?
So the only two things that I know of sure are going to be death and taxes. So I'm going to stick with that answer. I don't know. You know, I'm always kind of a cutting edge type person. I think, you know, in one way, I'd like to get COVID, hopefully a controlled version, and then get some antibodies. And again, even with antibodies, we don't know, are we going to be protected against a second infection? We don't know that. So I don't know. I think it's going to be based on herd immunity. I agree with Heidi, what she said. I think we do need to test more people, because I think we're going to find that a lot more people have antibodies, either to coronavirus in general or to COVID-19.
So interesting. And George?
Well, I think the herd immunity, you know, looking at Sweden, that's the one country that I lived there for a few years, and they are actually trying to, in a controlled way, get into herd immunity, because that's where they probably get there. They think they're going to get there in about 4 or 5 weeks, which, because it's not going to help them all that much, because they still travel and other people coming in, so still won't be all that great. So I agree. I think it's not going to be till we get a vaccine, or maybe some very effective treatment. I mean, we have some hints at some treatment, so that could happen sooner, but it's going to be a while. I hope that we don't actually go and bury ourselves live in a cave and continue this stuff forever, because the number of people that are going to die because of the efforts we've made, especially in third world countries, is going to be multiple millions of people, many more than will ever die from COVID-19. So I hope that at some point we get to a point where we understand the risk benefits.
Thank you, everybody. And I want to make a special shout out to Natasha. Thank you so much for your incredible work with this and how you make this seem so effortless. Many people, having seen other Zoom calls, will understand how much work Natasha does and how incredible it is that this runs so seemingly effortlessly, but we all know the reason why. Thank you so much, Natasha.
You guys are a great group. I mean, the knowledge and experience on these panels that you put together, Joel, is just phenomenal. And this one is no exception to that. So thank you all so much for being here. We really appreciate your time, everyone.
And thanks as always to Nancy. Thank you. Bye, guys.
All right.
Take
Take care, everyone.
Stay safe.